Hi, good evening. My name's Olivia, and I want to talk about my clinical experience at Ellis Hospital in Schenectady, New York. So this past weekend, I went there to do my 250 clinical rotation. It was a great experience. If I could do it all over again, I would. So let me explain how everything goes. So in 212 and 213, they start preparing you on the clinical site you want to go to. I happen to choose Ellis because it's 3 hours away because I live in Massachusetts. I live like the northeastern part of Massachusetts. So to get to the other side of to New York rather, that's going to take me 5 to 6 hours, and I'm not trying to drive that long just to go do a clinical site. So I chose Dallas because that's only 3 hours drive to get there. So you choose your clinical site and they'll place you where you want. So I let them know I want to go to Ellis Hospital. That's where I feel most comfortable, and I'm probably going to choose that site again for 290, to be honest. So they tell you your site, you get all your documents in, and then you're cleared. That's how you're able to get through to 250. Next, when you start 250, you need to order your scrubs from Dove. They'll give you the website Dove, and you tell them the size, and it's a purple scrub top and bottom. So my clinical suit uniform needs to be washed. I just went there this weekend, but that's how it looks. And then, but prior to all that, you have to get your badge. You have to have your badge taken care of. But that's a requirement, obviously, before you get to 250, and they mail it to you and whatnot. So you got that ready. For clinical, you have to wear your uniform all 3 days, because you go for 2 hours on Friday, then you have one full day on Saturday and Sunday. So you need to get those. You need to wear those scrubs, white sneakers. Sometimes you can wear like a white undershirt, I believe, and you have to wear your badge. So you're basically representing the school, so you need to look professional, as no at all times. So what else? So when you get to the site, you need when you okay, before that. So you got all your stuff ready. You should have before I get to talk to traveling and getting to the site, you need to have your drug book, your NANDA book, just because in case you have to do discussions with your instructor. And it's just good to know because you're going to be responsible for passing meds, and you're talking to these clients. You're the one, patients rather. You're the one that's going to be administering the meds. You need to know why you're giving the meds to these patients. So I'll get to that when I talk about the site. So it's good to bring that. You need to bring your own blood pressure cuff. Well, I mean, you can share, but I mean, people in the group shared. I bought mine because I'm used to doing that. I bought O2 pulse ox machine, and then I did get my thermometer as well in case anyone needed it. But the hospital does have its own vital signs machine that you bring with you. Although I prefer to use manual, I'd like to do my own, but whatever. Every policy is different. Every place is different, but that's far in between. So you got all your stuff ready. Then they give you a week, and when you go. So this is week 5 now. I went week 4, and I'm glad I went week 4. It's great. The week before, they set you up with the Zoom meeting to meet the instructor. You meet the people who will be going to Ellis Hospital with you. You meet your classmates. So it's good because she'll tell you what is to be expected. So you need to be professional. Like I said, like if you're a college student, you should be responsible. You should be respectful. Anyways, that should not be even told. You should already have that instilled in you anyway. But she'll tell you what she to expect. So my clinical instructor, really nice, sweet lady. I'm hoping to have her again 290, but She says you're there to learn, which is true. When you're there, you are there to learn. You're expected to know the meds and just follow policy, and she'll explain what you should do, what you should not do. And it's not that stressful as it seems. It can feel stressful and scary, but it's not as stressful as you're made to feel. So then fast forward week 4, then it's the weekend. For me, I left on a Thursday afternoon, and I wanted to get there to make sure I bring my stuff, make sure I don't forget anything. I brought my laptop so I can finish my homework, and I have my mind set and clear for clinicals. Got everything done that the day before I go into clinicals. And I also took that day to feel familiar and get to know the site. So when you go to your clinical site that weekend, you do have to stay at a hotel. I mean, you can also Airbnb, or I mean, if you live nearby, you can, I guess, find some sort of arrangements if you have family nearby. But for me, I stayed at a hotel for 3 days. So Thursday, Friday, Saturday, Sunday was the last day. I rented a car because I just chose to do that, whatever the case. But you can bring your car, you can fly there. I know there's 2 students that flew. So you go there, you're responsible for the expenses for your hotel. The school doesn't pay for it, you're paying for that because it's a clinical experience and you need a place to stay and whatnot and get yourself ready. So the first day, Thursday. I drove to the site from the hotel, and I drove to the hospital, and I got familiar with where to park. I even I emailed my clinical instructor. I'm like, so where do we park and whatnot? And she told me at the garage. I'm like, okay, good. I was right there. Perfect. So they'll tell you where to park and where not to park or whatnot. They'll inform you on what to do when you're getting there. The first day was Friday. You go, and then again you meet all your classmates and the instructor in person. It's so weird when you do that because they're on your phone or laptop and you're seeing them on Zoom, and it's so surreal when you see them in person. But it was nice. I met them, and the instructor was very sweet. She gave us our login for the system we'll be using at the hospital, and which is good. Then she gave us our assignment and what we're supposed to do. So which was good. She gave us a tour. We saw where we were going to be. Everything worked out. The next day, you needed to be there at 6 o'clock. Well, for me, 6:30 sharp. I went there 6. So I brought everything, like my drug book. I brought my NANDA book just in case. I bought my vital stuff, everything. So I was a little over prepared, but nothing wrong with that. So we were expected to do, she told us how the day was going to go. She gives us our assignments, our the patients, the past medical history, the meds we'll be giving because we were only given the 9 o'clocks. Then we do the INOs, the ADLs. We're taking care of that patient, help them get cleaned up, help them eat if they're not able to eat, walk with them if they need assistance. And then we do vitals again at 11 and then 2 o'clock. So I had 2 different patients on one different day, one each day, I mean. So they happened to be getting discharged, so I wasn't able to do my afternoons, but I did their vitals, and then I used my regular blood pressure cuff and stuff to assess the blood pressure, at least within the time before, an hour before giving meds, because you need to know, because if you're giving cardiac medications, you need to know the apical pulse and the blood pressure in case you have to hold it, and then you have to document it in the system. So I'd rather use my own, but we had to use the automatic machine, and I wasn't a fan of the automatic machine. I'm not a fan of those, but policy's different everywhere. So I did that, and passing the meds with the instructor wasn't bad. It was actually easy. So you just obviously go in there, you identify the patient, you do your 3 checks, right? And with the medications, you have to scan the medications each, and then you tell the patient what they're getting these medications for. The thing with these patients is they don't mind that you're a student. They understand you're there to learn, and whether they know why they're on a medication or not, they're happy to know that you're learning, to be honest. So for me, I recommend before you're giving the meds, review the list of meds with your patient, and then also you need to understand why you're giving the meds. Like some of the meds there, like I had the basics, there's one cardiac medication. I knew it was a blood pressure med, but I didn't know what kind it was. So I looked into it anyways because it was a sartan. So I'm like, oh, okay, it's for blood pressure, da 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 da. So I explained that to the patient, and yeah, it went well. And then yeah, they gave the med. Great. Another thing, the most important thing is for you to know your head to toe assessment. Very, very important, because that's what they're grading you on. So before you even go to a hospital the night before, review your head to toe, because that's something they teach you to do way back on the beginning nursing classes. Like I think it was 104, 109. You had to do the head to toe. And that's something you probably do in your job all the time anyway. So you review your head to toe, and then you demonstrate it with your instructor. The instructor is there to also help you and assist you. So she was very helpful, and I did well with the head to toe. I could have gone a lot longer, but she was trying to obviously speed it up because she has a lot of students. But it worked out well, And if she feels you're competent to do it, the next day on your own, you do it the next day on your own, and which I did. So it's important that you do the head to toe, so that way when you have a patient that has an issue, because again we were in a cardiac floor, anything could any kind of problem can arise, and it's good to know that there's a change of condition when you're on that shift. By patients, again, they're getting discharged that day. But my other my other patients with not my other patients, my other classmates with their patients, like they had a change in condition, which was really important to know, to go through the head to toe. And then plus you do have that assessment and you're able to write it down. So it was a great experience. So it won't always be busy, because sometimes, like again, I had 2 patients get discharged. So in my downtime, what I did was document, obviously, and then I would help out my classmates. That's another thing they're looking for, teamwork. So when you're not that busy, you can also observe what's going on the floor. You can observe what the techs are doing. So because for me, I didn't know how to do a pirouette, and I observed the tech teaching me, doing it and teaching me as well, so which is good, and that's something I hope to learn to do during my practice. Then you help another student out. It's rewarding, and then plus that's what the teacher wants to see, and that's what we're there for, is teamwork. So clinical was actually a really good experience. It's not as hard as it seems. It's a great experience, and I promise you that you'll have a good, you'll form good relationships with your classmates and your instructor. You just need to show them that you know your stuff, and that you're competent enough to perform as a nurse. So good luck to whoever's going to the next clinical. I know I want to go back to Ellis Hospital again for 290, and I'm looking for it, and I'm excited. So I hope this video reaches you, and I hope you can learn a bit from it. If you have any questions, obviously comment in my video and be welcome to answer anything you like. All right, thank you and have a good night. Bye.